You're listening to Just Medicine, an equity in healthcare podcast created by medical students in British Columbia. Hello, everyone, and welcome to Just Medicine. My name is Shadan, and I use she/her pronouns. I'm a fourth-year medical student at the University of British Columbia, coming to you from the traditional, ancestral, and unceded territories of the Musqueam, Squamish, and Tsleil-Waututh nations. Just Medicine is a student-led podcast that aims to further explore the fourth tenet of medical ethics, justice, and in particular, social justice. In this series, we will be interviewing physicians, community leaders, and activists about different social justice topics, how they relate to medicine, and what we as medical trainees and future physicians can do to create a more sustainable and inclusive patient care model. What is social justice and why does it relate to medicine? For many generations, we've learned that medicine exists outside the sociopolitical realm. But recent research has shown that there are direct links between socioeconomic disparities and health inequities. Our patients exist in social, economic, and environmental conditions that are formed by centuries of injustices and discrimination that directly and indirectly can cause, contribute, or exacerbate diseases. So comprehensive patient care cannot exist in a vacuum without considering the broader societal context that forms our patient's socioeconomic condition. For us as medical trainees, maybe the best known part of socioeconomic conditions is the social determinants of health. And perhaps a good example of this is the all too familiar patient presentation to anyone who's worked at St. Paul's Hospital. St. Paul's Hospital is a hospital in Vancouver that serves a large population of unhoused individuals with substance use and mental health disorders and a lot of complex social situations. In this case, an unhoused patient is brought in with an overdose who gets treated for their presenting condition, the overdose, and then they are discharged with follow-up to a primary care clinic and a social worker, but they are brought back in a few days later with another overdose because they weren't able to get to their follow-ups. But social inequities can be more subtle and much more applicable to different patient populations. They can manifest as a reluctance to seek healthcare because of intergenerational trauma from institutions like the healthcare system, or years of smoke inhalation from BC fires causing lung damage, or an increased risk of cardiovascular events because of food insecurity, so people aren't able to obtain wholesome and nutritious foods. So to treat the presenting problem without considering the systemic conditions that created or contributed to it is to treat a symptom and not the cause. The tenet of justice in medical ethics aims to ensure the equal distribution of resources and opportunities to patients. However, the underlying assumption in this principle is that all patients have the same needs and are at the same starting point. Social justice in medicine takes a more nuanced approach towards health equity rather than equality. Health equity aims to provide tailored support to the patient based on their socioeconomic conditions to improve health outcomes. So equity is a lot more focused on outcomes rather than specifically equal treatment. Health equity also extends beyond the individual patient and examines the system in place that create, contribute to, or reinforce health disparities. The first step in health equity is to recognize the historical and systemic factors that contributed to the present-day social determinants of health of our patients. With that knowledge in mind, we can then take action to alleviate these conditions and ultimately improve patient care. Physicians and medical trainees can play a remarkable role as advocates in spearheading social justice initiatives. But it can be difficult to know what you don't know or even what you can do in your capacity as a medical student or resident. In this podcast, we want to bring guests who can share their stories with us, highlight important social justice work, and also provide us with the knowledge and skills to become more adept at not only providing inclusive and comprehensive care for our patients, but also to address the systemic injustices in our society that ultimately contribute to our patients' well-being. We will be covering a variety of topics, including environmental justice, Indigenous health, LGBTQ care, disability and neurodivergence in medicine, reproductive health and justice, and much more. We invite you to learn and, maybe more importantly, unlearn with us on our pursuit of equity in healthcare at Just Medicine. We will be sharing some introductory resources in our show notes. If you have any questions, want to suggest a topic for us to cover, or know of any experts in a particular field, please email us at justmedicinepod@gmail.com. Thank you so much for listening. This is Shadan with Just Medicine, and we're very excited to learn with you more soon. Thanks for tuning in to Just Medicine.